ReJuvePeel is the strongest of the peels. The first thing that you're going to notice is that it's truly going to peel the person. And so you want to be sure that they know this. This is the only peel that's associated with some significant downtime, so that I like to tell patients that their peeling will usually start in 2 to 3 days after the peel is performed, and it is typically going to end 10 to 14 days afterwards. So it's very good to forewarn people that they almost need a 2-week block of time to be sort of, out of social situations. They can go out to dinner, things like this. But if, for instance, this was going to be done before a wedding, a big occasion, anything like this, if someone needs to make a presentation for work, they're not going to be camera ready for about 2 weeks. So we're going to ask our next person to come on up. And you'll remember that we sort of talked about prepping the face. I just want you to get nice and comfortable. Okay, and when it comes to prepping the face for the ReJuvePeel, we found that the prep is very, very important. Very interestingly to us, we found that a good alcohol prep really, we've done sort of half bases to see that if you do a very good alcohol prep, you get about the same degree of peeling that you'll get if you put the liquid retin-A, the liquid tretinoin on after the peel is done. So we can't overemphasize the, I'll say sort of the aggressiveness of the prep. I like to use just a plain alcohol pad. Some people may use acetone. Frankly, I don't like acetone as a degreasing agent, only because for most women, it just really conjures up the thought of nail polish remover all over their face. So I like to use the acetone. This is a very good patient. We've asked her to come in with no makeup, and we see that there is no makeup. But your end point here, I'm going to ask you to keep your eyes closed the whole time, Carol. Your end point here is actually not just no makeup or no lotion like we were with the others, but you really want to be sure that that you degrease the face well. So this is going to be 2 to 3 rounds of the alcohol pad. I will also tell you that you do need to have ready either your little cosmetical fan, or some of you I know use battery operated fans, but the patient typically with this will experience something that's going to be more than just a little sunburn reaction. There's going to be sort of more of a feeling. If we say that the Pro-G gave a tingling, the ReJuvePeel is usually going to be more of almost a little bit of a stinging sensation. So we're doing this. The indications for this, first of all, this is someone who has committed to stay out of the sun for at least the next 3 months. We're doing this for some very fine facial wrinkles. She would like to have a decrease in facial fine lines. She wants to have an evening of her skin tone, and we also have taken some stills that we'll be posting, actually a series with before and after, but she wants to have an evening of skin tone and really some resolution of some solar lentigos, which, as I find in most patients, just as in this, that she's got them mostly laterally and more on her driver's side. So we're going to really opt here for lessening of fine lines, improvement in skin tone, decrease in solar lentigos and age spots, and then I'd like to see some firming of her skin. And I think that we'll really get all of this if we get to the level 3 frosting. So I want to just mention that one more time, that, or actually for the first time during this session, that we call the ReJuvePeel an adjustable peel. And what we mean by that is that if you have a patient who likes to come in every month and who just cannot, and can come in every month, and who can't afford any downtime, then that person, you would do the ReJuvePeel, and you do it to level 1 or so frosting, which is sort of a lace-like look to the frosting. if instead you have someone, as we have here, who really wants to, from one peel, see firming of their skin, a sustained firming, decrease in age spots, increased evening of skin tone, and decrease in fine lines, we're going to bring this to adjust it to the level of level 3 frosting, or at least sort of a 2-3 intermediate, meaning that the frosting is going to be much more continuous, and we're going to get some erythema underlying the frosting. So again, we're going to be using the foam brush, and we're just ready to start. I'm going to give the patient the fan to hold in case there's any discomfort. In fact, there will be that little bit of stinging, and we did this peel probably about 2 years ago on this patient. So and I want to mention to you, that's my fault. We should really get people back in. I like to get them in every 6 months. If they've had the really, strong reaction of a level 3, then even once a year is good. So we're going to start always on the forehead. Now, this is not timed because we're not going to be washing it off. So on this one, on the ReJuvePeel, you can start on the forehead and you can just wait. I may not have made enough of a point when we were demoing the other peels, but because they're timed to wash off, you really need to be doing it very continuously. This you do not need to be doing continuously. As a matter of fact, we want to sort of get a sense of what's going on, and the one thing that I'm going to mention to you is you got to sort of let the peel solution dry. This is the only solution that's truly very, very watery. The others are more gel-like. I will say to you that I don't see any kind of frosting, so I feel very safe that we can go ahead and apply more. And just like we did, the pattern of applications going to be just like we did for the others, where we're going to come to the lateral face. She happens to have, as we mentioned, her age spots, early solar lentigos on the lateral face, so we're going to really be sure to put a good volume there. And interestingly, I think I'm seeing some frosting here already. Carol, do you feel the burning there, but not so much on this side? And I think that that's almost to be expected because people have got the chronic sun damage on their driver's side, so that's more compromised skin.
Correct.
So now we're going to just sort of come again from lateral face. You'll notice that a lot of times I go on the chin almost last of all for reasons that I certainly don't understand. The chin can be the most sensitive of all. See, and then I did do one thing that I wish I had, which is that, and I'm sorry because, ultimately it'd probably be the best practice to actually put a little bit of a bib on the person, because especially for the first time, you don't want to be using this at all on the neck. As a matter of fact, a great practice is if they're doing the ReJuvePeel on the face, then you may want to be doing something where you're doing, for instance, Pro G70 on the neck and chest. And in our history with this patient, we know that she does not frost easily. So by the way, for those of you who are watching who sort of are used to the concept of passes, to me this was all the first pass. And we just wanted to be sure to have adequate enough volume. Remember that this is a peel that sort of requires some patience on the part of the peeling professional, of the person applying the peel, because you've got to really wait typically a good, I'd say anywhere, like we saw on her more photo damage side, we got the mild frosting within a minute or two, but on her forehead, which has been protected by bangs all these years, we don't see any frosting yet, but we want to make sure that it's dry. So you've got to wait several minutes between layers, between the application of the layers. We're going to wait just another minute, but I do know this patient very well, and I knew beforehand that it would absolutely take several passes to start to see, do you need, but Carol, what would you say in terms of how much stinging you're feeling?
I'd say about a 6.
Okay, and is it on both sides equally?
More side, I would say burning more side this side than this side.
Okay, and that's interesting because she has a little more frosting on this side. And when we say frosting, it sort of looks like a very mild whitewash on this side. But remember that a lot of peel protocol has to do with the volume applied. And I think you will notice that I really, although I'm calling it just one pass, because this side immediately started to have a very light, almost up to a 1 frosting with just the one set of volume applied. I went back over this so that my first pass really applied more volume to this side, and Carol's sort of feeling that. So what we're seeing is we're seeing some degree of frosting. Definitely there's a very light frosting even on Carol's forehead. Best way to describe it is just a really sort of like a slight whitewash. And then we're seeing some increased erythema, especially on this side of the face, the central face right here on her right side. But all of that said, it has been several minutes since we did the first pass. So now we're going to start with the second pass. And again, best practice is do start it on the forehead. We want to be sure to actually get into glabellar crease, which I may have missed glabellar crease first time around. Where Carol has more redness, I'm going to hold off. This is sort of nice because it's almost sort of like, I don't want to say paint by numbers, but unlike the less aggressive peels, with this you really see just where the product is reacting. And even though we did not see real frosting in the redder, more sensitive area to start, now that we are going to our second pass, we're seeing a white frosting developing right through the central cheek here. Carol, you can go right ahead and fan yourself if you, do you feel that you need to?
Oh, yes.
Right?
Yes.
So now you had said to us after the first pass, the first go round, that you were feeling about a 6.
Correct.
What do you feel now?
I'm about up to an 8 now.
Okay. I will tell you from the experience of doing many of these peels, I think that Carol will be, I don't think that we're going to be even applying any more. And Carol, I'm going to be a little more aggressive. Now, why are we really stressing the fan here when we didn't with the other patients? The reason is because we don't want anything touching this acid peel for the next 2 hours. In other words, we're not going to be doing any kind of a wash off here. In fact, we really cannot neutralize this peel. All of the ones we've done so far, we had, the first was really the enzyme treatment. The 3 Pro Peel series are all very superficial. But with the ReJuvePeel, which is, by the way, the modified Jesner's, so it's 14, 14, 14, lactic, salicylic, and resorcinol, plus the copper tripeptides. With this, there is no neutralizing, no wash off. So you really want to be very sure that if the patient says that they're uncomfortable, get this fan on them, but please don't be applying the water because you've got to have this settle. We also have in our physicians or our training manual, the staff training manual, we have the protocol for what the patient would be told, and you can just print this out and send it to them, the post-peel instructions for the ReJuvePeel. Something that I love to be sure to tell all patients is that tonight I want you to sleep propped up on a couple of pillows. Reason being that we are going close to our eyes, there will be some swelling from this, and it's really only the very delicate under eye skin that could look puffy in the morning if the patient doesn't sleep propped up on a few pillows. It also says do not wet the face or apply anything for 2 hours. That means that the person should not be having this treatment and then going to watch their son's soccer game immediately afterwards, because we really don't even want you to be putting on sunscreen, which could actually dilute the peel. So in terms of minutes, we've now gone another good 3 to 4 minutes, and you really can see that we're getting a pretty full sense of the beginning of a level 2 frosting. And why I'm saying this is because I don't know how well this is showing on camera, but we've got a pretty nice whiteness, and then with the white wash look, and then with the level 2 you're getting the erythema, and we're seeing all of that. What I will do is that we have really a little less response in the very lateral face on this side. So because we want to have as much of an even response, we're going to redo that area. And the other thing that I will say to you is that she actually did have a good amount of solar lentigos in her lateral face. We want to be positive that we are, putting an adequate amount of volume there. This is the bottle that you get of the ReJuvePeel is a 2-ounce bottle, and typically you're going to get about 8 peels out of it, if you're wondering about volume. So I took, about 1/8, which is about 1/4 of an ounce. I think in some offices you do use little glass measuring cups. Carol, do you need the fan again?
A tad.
Go ahead, you can do it. So this is a peel that in my own office I just find sort of miraculous. For patients who come in who are injectable patients, patients who are wanting other procedures, I always like to, in the case of someone who has a little bit of advanced lines or photo damage, I like to talk to them about doing a ReJuvePeel. An expression that I like to use is it affords me the opportunity to treat every square millimeter of your face. As far as pre-treatment with this, people do not need to be pre-treated with hydroquinone. You should not have any hyperpigmentation, post-inflammatory hyperpigmentation afterwards. I will tell you that for the first 3 days or so, I like them to use less product than usual. They really just need to be using things that are going to keep them comfortable. The VitaSoothe is one very good thing, and the other is the O2 Lift Mask. That's very hydrating. It's honestly a little less expensive formula and a little less expensive way to hydrate up the skin, to keep it well hydrated, and also to help to reduce some of the erythema. We've seen that both VitaSoothe, which has 2 forms of vitamin E, and the O2 Lift, which is actually based on a yeast extract. They both are very good at helping with facial redness and keeping the skin well hydrated. We can really see as time is going on that we're getting more and more of that really sort of more continuous frosting seen with the underlying erythema. So again, I think that one of the sort of hallmarks to best practice for this particular peel is to have patience to wait between your layers to be sure that you're fanning not only for patient comfort level, but also to dry the product so that you can really get that frost, or you can ascertain the level of frost before you go to the next pass. Carol, now what would you say about level of stinging, which is?
How about down to maybe a 6 again?
Okay, great.
It seemed to subside.
Good, okay. And that probably, Carol, is pretty much how you're going to be feeling. Now, for, really for the next several days, you're going to feel a little bit like you've got a sunburn.
That's exactly what I feel.
Right, like a sunburn, right? Now, if it gets uncomfortable, remember that after 2 hours, you can put cool compresses on. You're not really gonna be able to wash this off. The acid is seeping in, but you can put on cool compresses for comfort. You can put on your O2 lift mask for comfort, a little bit of the hydrating vitamin C peptide spray.
Okay.
Also, if you felt a really strong sunburn reaction, which I don't think because of what you're describing now, but if you were to feel that, you could take 1 to 2 Advil, and that's tremendously helpful for making you feel more comfortable.
Okay.
But this is really just where we want it to be. We're at that really level 2 to 3 frost. Now, what we'll do is we'll get Carol back in a couple of days, and any area that doesn't look like it's taken quite as well, we'll just paint on as a spot treatment. Carol, I want to thank you. I will also just mention one other thing. A lot of our cosmetical clients do ask our skincare specialists, what about at-home treatment when you're all done? And if you're not already using our different regimen boxes, then I'm going to suggest to you that you do consider using them, because this one I'm just showing is the acne, which is what we have. Thank you. What we have our Pro G person using. We also have younger 1 and 2 regimens, which would be after the ReJuvePeel. And please just call our office, 954-587-8989, or go to www.cosmeticaltechnologies.com for a tremendous amount more information, customer support. Please keep up with us. Remember that we're always just a phone call away.